Yeah, that's right. Okay. All right. Oh, do you really? Okay. We'll let you know. We'll let you know. Yes. All right. Well, happy St. Patrick's Day. It's really good to be in Palm Harbor. Hey, how you guys doing? Good to see you. We're excited. I want to thank Chairman Dave Eggers, Chairman of the Pinellas County Commission. I think I've known Dave for about 30 years, probably, since I was 12 years old. So he's a great guy. He's doing a great job. We're excited here for this, this site. This site will be offering 500 Pfizer vaccines per day, but we've also decided to surge 2,000 Johnson & Johnson. So they're doing about 200 a day. So this is kind of a 10-day pump with J&J. The site is open to individuals age 60 and older. And, you know, obviously we still haven't done every senior that wants it, but man, we've sure done a lot. We've done over 3 million seniors in the state of Florida have gotten shots. We're closing in on having done 2/3 of all seniors. Pinellas isn't quite there, so hopefully this will be another push to be able to get more and more in Pinellas. And I don't know what the ultimate demand is going to be. I think what we've seen in some counties that have gotten into the mid-70s with their senior vaccination rates, it does start to peter out. And so I don't think you're going to have 90% demand. I think probably 2/3 to 75% is probably where we'll end up. We're pretty close to that. Obviously, we're opening it up to 60 to 64, which seems like it's been going well. The reports have been good around the state. I think partially is because when we started 65 and plus, we had 4.5 million seniors. Most of them wanted it. And then we had about 200,000 doses a week to cover that many people. Well, obviously the demand was much more intense, and that's gotten better. And we're still not where we want on supply. Our supply is pretty stagnant. It seems like over the next few weeks, probably about 400,000 initial doses, Pfizer and Moderna. We have no more J&J coming for the foreseeable future. For the next 2 or 3 weeks, we're not anticipating any new J&J, and I don't know what the issue with that is. Hopefully we'll get more of that soon. But I think because we've obviously done millions of people, the 60 to 64, there's about 1.4 million Floridians in that age bracket. Not all of them want it, many of them do. So I think it's been a little bit easier to get the appointments than maybe it had been 2 months ago. And obviously as the supply increases, we're going to be continuing to do that. I'm not going to announce yet, but we definitely will lower to 55 sometime in March. I think we can get that done even at the current stagnant supply. We're looking at the demand, seeing, you know, when we first did this at like pharmacies, if you logged on 5 minutes late, all the thousands of appointments would just be gone in a matter of minutes. Well, now if you log on, it's a little bit easier to do it. Now they still get taken up, but it doesn't happen in 2 or 3 minutes like it used to. So that's a sign that it's a little bit better equilibrium. So as soon as we start to see more availability, then you lower the age to 55. But I'm pretty confident. I mean, we have 1.4 million people age 60 to 64. Florida's done, I think, over 300,000 just in that age group. Obviously, we're doing more every day. And I think that lowering that age is something that's going to happen hopefully pretty soon. So as soon as we have the announcement, you know, we just want to make sure when we do the announcement that we don't create a crush on the system. We still have seniors that are getting shots, which is great. Obviously the 60 to 64, and it's about another 1.5 million Floridians when you go down that extra 5 years from 60 to 55. So you just have to be able to absorb it. But I think we'll be able to do it. And look, we believe Seniors First works. If you look at the rolling average of cases, you know, it's down 75, 80, 90%, depending on, you know, when you look from January or February to here among senior citizens. And that's really the point of this, to try to have the vaccine for the people that need it the most and that are going to be more at risk than, say, somebody that's 22 and very healthy. And throughout the whole pandemic, Florida ranks 41st for senior mortality. In other words, 40 states have higher per capita mortality for COVID for seniors than the state of Florida. And I think part of that is a testament to good medical care in the state with our doctors and nurses. Part of it is, you know, we protected nursing homes in ways, as we're seeing, that many of these other states did not. but also with the vaccines. I mean, we think that we've tried to put the vaccines where they can do the most use. So we're going to continue doing that. As I mentioned, we've done over 3 million seniors have gotten shots, and we're closing in on 2/3 of all seniors in Florida getting shots. That'll happen. Probably those numbers, as they're reported, they lag. That probably has already happened, but certainly that'll be reported out over the next couple days. So we're really excited about that. We're also excited to be able to announce further expansion in retail pharmacy availability. So beginning this weekend, Walgreens is increasing the number of stores offering vaccines from 126, which we just announced an expansion last week. They're expanding again, so there's going to be 223 Walgreens throughout the state of Florida that will offer COVID vaccine shots. CVS is also increasing. We announced a recent expansion of CVS. Now they're going from 157 stores to 182 stores statewide. And so those Walgreens and CVS, this is their bread and butter. They do it very well. The more we can get those stores to have vaccine, I think the easier it is going to be for Floridians to be able to do it. So if you add those expansions, 223 Walgreens, 182 CVS's, we have 730 Publix throughout the state that's offering it. We're now up to 204 Walmarts and Sam's Club, mostly Walmart, but some Sam's Club throughout the state. And then we have 43 Winn-Dixies throughout the state that are offering it. So in Pinellas County alone, we have 42 Publix pharmacies that are offering shots, 13 CVS pharmacies offering shots, 10 Walmart pharmacies, and 2 Sam's Club. So that's a pretty good footprint from a retail level. Of course, you have this site here. We also have the site in St. Pete that's doing 9,300 shots a week there in conjunction with the county. So we feel like there's a lot of good things going on here in Pinellas. And our site at in Pinellas Park at Mainlands was very successful. We did 3,000 seniors over 3 days. They were very appreciative of doing that. That helped get the numbers and the coverage in Pinellas up. We did that many weeks ago, but that's really, really good. So we're also doing stuff with rural communities. If you look at the senior coverage rates in Florida, every single county that has a sizable population is over 50% now of seniors. The ones that are still in the 40s are mostly these rural counties. So we do have a rural program where we're doing outreach to try to get as many seniors. I will say the demand is not uniform across every section of our state. That's just the reality. So there's some of those rural counties we've offered to surge vaccine, and they said, you know what, we're having a tough time filling out the existing appointments. There's other counties like Highlands. We surged there about a week and a half ago, 2 weeks ago. They went from like 35%, they're like 55, 60% of seniors now. So that one obviously worked, but we are continuing to work with our rural communities just to try to get the coverage rate up as high as we can. And we're also doing more on the Homebound Seniors program, which I think has been very successful. We've had some seniors here in Pinellas, some World War II vets, great folks, and we're happy to be able to do it. So I think that if we're not getting more J&J, I think the J&J has been very popular. I didn't know how people were going to react to it because the clinical data was fantastic, but it was presented in the media somehow being less effective when it really wasn't less effective for preventing death and serious hospitalization. It was really a little less effective for mild, like a cold-like symptom. But that's not why we're concerned about this. We're concerned we want to keep people out of the hospital, obviously save lives, and J&J's been proven to do that. So we didn't know, so we put it out. And I'll tell you, everyone has been really interested in the J&J. You do one dose, and then you do. So everyone here that's doing J&J, they're not going to have to set up a site back here again in 3 weeks or 4 weeks to be able to give a second. They don't need to. Now, they'll do it for the Pfizer. But as you do J&J, people do it, and they're able to go on by their way. So we think that that's something that's been very positive. As we get more allocated for J&J, we'll obviously let everybody know that. We want to get that out. But I just want people to understand, if you've been waiting for J&J and you have an opportunity to get a Pfizer or Moderna, I'd recommend getting the Pfizer or the Moderna if you can do it, because I can't guarantee you there's J&J is going to be available next week or the week after, or even, unfortunately, we're looking maybe 2 to 3 weeks into the future where we don't have J&J allocation. So that's just what we're looking at. It's beyond our control. So just keep that in mind, because if you're able to get Pfizer now, you could have the booster done probably by the time any new J&J shipments are going to come. And we'll also be updating people. If we do get more allocations of Pfizer or Moderna, we will. But we've been very flat now for a couple weeks, and it looks like the couple weeks into the future is going to be very flat as well. The federal pharmacy program, they've gotten some slight increases, but nothing earth-shattering. I think if we get the J&J to start flowing, a little bit more on Pfizer, Moderna, once that happens, you'll be able to open it up to everybody, I think, because I think the supply will be sufficient. We're not quite there yet, better than where we were 2 months ago, but still not getting the type of doses where it's just going to be readily available for everyone without an appointment or anything like that. Finally, I'll just point out, we got this federal stimulus money that's supposed to come down the pike. They did the formula so that states like Florida that have low unemployment get less money. So we're actually getting penalized for keeping our businesses safe or keeping our businesses solvent, keeping people employed. And then you have states like California that have almost twice the unemployment as Florida, have been locked down, no kids in school. COVID metrics, really for seniors, they're worse than us in COVID metrics, and yet they're getting much more money. New York is getting much more money than they are per capita. So my view was you should just give it based on population. They didn't do that. They decided to penalize Florida, penalize Georgia, and reward Illinois and New Jersey, New York, and California. Nevertheless, we're getting some money. So I put out a supplemental budget request yesterday. We think we're going to get between $9 and $10 billion. I only recommended for now $4.1 billion of that. So some of that will be our Department of Transportation work program to make sure none of the projects are delayed. They had to delay some of them because of the revenue outlook. Now the revenue outlook's gotten better, but being able to put that in there will be really good. We want to keep these projects going. We're also doing $1 billion for an emergency response fund. Now what happens is when a hurricane comes or COVID or anything we're doing emergency, we take general revenue, we go do the expenditures, and then we got to wait for FEMA to reimburse some of this stuff. Well, we're going to have a fund set up, $1 billion. Everything will be paid out of there. The reimbursements will go back into that fund. We will never have to touch, hopefully, general revenue again. So I think it makes a lot of sense to do that. Obviously, we'll still have some expenses with COVID. Knock on wood, hopefully we don't have a busy hurricane season, although last season was very busy, and all things considered, we had a little bit in the panhandle, some other stuff, but it could have definitely been a lot worse. So hopefully we get through hurricane season without any major disasters, but I think that's going to be good. We're also doing $1 billion for our Resiliency Florida initiative. As you see these storms, as you see flooding, sea level rise, we're going to build more infrastructure to be able to guard against that. I think that'll actually help us reduce property insurance in this state if they see us making those types of investments. So I think that that's a good thing as well. And we're also doing $200 million to do a $1,000 bonus to every sworn law enforcement officer, firefighter, and EMT who've been working really hard over the past year. So I think that that's a good thing to do. Yeah, you guys are going to get, there you go. Maybe I can hand out the checks at the 9/11 when I visit you guys. We'll see. So, but I think that that's good. We're also using, recommending the legislature appropriate some of the money to address some needs with our National Guard who've worked very hard. I get a lot of great correspondence for people who, when they go to get the vaccine, they think like it's going to take 10 hours, whatever, and they go in, they say, look, it's efficient. We had a good time, all this stuff. And a lot of times they'll cite the National Guard's involvement when the National Guard's involved in these sites. So they've done a great job, so we want to be able to do that. But I only recommended a fraction of this. There's a lot of money for the legislature. We'll work with them on what would make sense on some of those things. I just did a civics proposal today from some of the older CARES money involving education, and we want the legislature to work with us to appropriate that. So I think if you go back, and I saw this on Fox, they're like, Florida's got a $2.6 billion shortfall. Understand, that was done in April. There's a huge difference in terms of what they were projecting now and what's actually happening here, because we have unemployment nationally is 6.3%. In Florida, it's 4.8%. We're getting hundreds of millions of dollars in revenue over and above the budget forecast for these months. And that's just because People are working. People are trying to buy homes here like you've never seen. You go ask these realtors, they've never seen anything like it here in Florida. They're leaving lockdown states to try to come to Florida because they can get their kids in school. They're able to do things, and we trust them to make decisions for themselves, not locking them down. So the long and short of it is, we're going to have a budget surplus for this year and for next year. Obviously, this funding that we have, I don't necessarily need it, but we're going to put it to good use for the people of Florida. So we look forward to working with the legislature over the next couple weeks. And with that, we'll take a couple questions. Yes, ma'am. Well, so a couple things. So the question is about contact tracing. I think we have to admit that contact tracing has just not worked, okay? And I'm going to actually do, tomorrow, I'm going to have a panel of experts. We're going to do a conference call on Zoom with, people like Sunetra Gupta from Oxford, Bhattacharya from Stanford, some of the Martin Kaldor from Harvard Med. And I think they'll all say, a respiratory virus where you usually have modest symptoms or no symptoms, it's just hard. It's not like an Ebola or a sexually transmitted disease or some of those. So I think it's largely been ineffective. Now, and the contact tracing is not all done. As you know, the county health departments, the state funds some of it, the counties do some of it. Some of them do it differently than others, so they have a level of autonomy. So you'd have to, I think, ask on each county how they do it. But I will say this, and I think even people that were advocating contact tracing at the beginning have acknowledged it just hasn't, there's not a place you can say it's really bent the epidemic curve downward. You go to some of these other states, you go to a hotel, you got to fill out all this information about anyone you've been with or talked to or whatever. And we don't do that here, and there's not been any difference in performance with it. So I think, unfortunately, it's not been something that's been terribly effective in Florida or throughout the country. There probably is data. I mean, I think part of the issue is, so for example, we dealt with this with the restaurants. I was a big supporter of our restaurants. I mean, these are family businesses, and my view was if you don't want to go to a restaurant, then don't go. That's totally fine. No one's saying you have to go, but we got to give them the ability to make ends meet and put food on the table, their employees, that. There's a question about contact tracing, how people do it. Well, understand, when they ask with contact tracing, what they'll say is, okay, you've been infected. Have you been to these places over the last 7 or 10 days? But they can't prove that you actually got infected in that restaurant, right? But even with that, the restaurants were very low in New York and some of these other places. And so, I think part of it is just it's very difficult to actually identify when you've been infected. If you're just out in public, to say that, okay, you were at a restaurant, you were at a pier, you were at a baseball game, all this, how do you know, who it does? I think the one time it's easy to do it is when you have household transmission, which is quite frankly, the vast majority of cases are transmitted inside households, and that's what we'll see. So the contact tracing on that is kind of obvious. Someone's spouse gets it, they get it, the kids get it kind of deal. But in terms of being out in public, they have a tough time really pinpointing where people are getting infected. Yes, sir. Yes, ma'am. So what that is so the state, we're doing firefighters, police, school employees 50 and up. And I'll tell you, we were actually going to set up special pods at schools, at police departments, sheriff's departments. But what we found is a lot of them were getting shots. And so a lot of them were getting taken care of in that 50 to up age group. What the federal government did is they said anybody that works in K-12, regardless of age, is eligible. So at those FEMA sites, they do it regardless of age. Now, we're not doing that because we're following the data. And the data tells us if you're a 22-year-old school employee, you're at less risk than somebody that's 70 or 65. So we're focusing on the 50 and up. But on those FEMA sites, they will do anybody at any age. No, I don't think. I think what that was one of the counties was doing that on their own. Right, but it was dictated, I think, by someone in the county. I've asked my folks to look at that. the end of the day, you know, we've set out a process. You see a lot of people who still need vaccine. To have healthy people, young people jump the line, that's not good public health, and that's not what we're doing. So I've asked them to look at that, but that was not something that the state ordered in any way. Yes, sir. Well, so it's interesting, though, if you look at that. So Hernando is a place we've surged vaccine to because they had low senior coverage rates. Right now, Pinellas has higher senior coverage rates than Hernando just crossed 50% of seniors. So I think it's a demand issue in Hernando because we've worked really hard to send extra vaccine there to try to get their numbers up. So at the end of the day, I think they have a lot more seniors that still need it. Now, if they have open appointments, what I would say is if only half of your seniors have gotten shots, reach out to the community and try to get some more of those folks to come in. Because I've got counties where 80% of seniors have gotten shots. St. John's, Lafayette. I got in Palm Beach County, there's a huge county. We've got 70-some% of seniors. I think 71, 72% have gotten shots in Palm Beach. But yet in Hernando, it's like 50%. So we are going to lower the age very soon, so that'll do. But we just lowered it to 60. So that tells me, I think, that we need to work on recruiting, get more people interested in the vaccine there, because there's still, of all the counties that have 100,000 or more, I think Hernando is the lowest in terms of seniors coverage shots. And I'd like to see that get higher. I mean, you got a lot of elderly people there. If some are skeptical about it, maybe provide some additional information as to why you do. Look, we are never going to do a vaccine mandate here. Don't worry about that. At the same time, we want to provide the information, and I think the data is very strong that this is something that's good for people to do, particularly if you're in those elderly areas. Yeah, so so this, and I don't know if some of you guys have seen this critical race theory. It's basically teaching kids to hate our country and to hate each other based on race. It puts race as the most important thing. I want content of character to be the most important thing. I want to treat people as individuals, and I want the history of our country taught accurately. And I want people to learn about the Founding Fathers and learn about the Constitution, as well as other great people like President Lincoln, like what we did in World War II, like the Civil Rights Movement, like winning the Cold War. Those are all very important. When you start talking about these wacko theories, it's all designed to put a political agenda under the guise of history and civics. I don't want politicized civics. I don't want politicized history. I want accurate history. I want to make sure people understand that this is a great country, okay? And if you want your tax dollars funding education that's going to run down this country, you got the wrong governor, because I am not going to allow that to happen. Thanks, everybody.